Okay, we're live. Good morning, everybody. I'm joined by Dr. David Samadi. I'm Sergeant Major Rudy Carter, U.S. Army retired. Uh, Before we begin for my interview, Dr. Samadi, I'll give you a little background on myself and Dr. Samadi. I was diagnosed with prostate cancer back in 2018. And as you can imagine, that was a harrowing experience for me. But through faith in God, I was put in contact with one of the best doctors, in my opinion, Dr. David Samadi. Come June 24th, that will be my 3-year anniversary. There are doctors out there, but not all doctors are created equal. You got bad, you got good, you got better, then you got the best. And I think what separates Dr. Samadi from any other doctor is his relationship with his patients. And so I just want to say to all you, those of you who are out there, if you want to post comments, remarks, please do so. I want to thank him for taking the time out of his busy schedule. And before I get into questions, I want to take the time to thank some people who made this interview possible. First and foremost, I want to thank God for delivering me such a great man. And I say that wholeheartedly. This is not a paid interview. When I came home and I was diagnosed with prostate cancer, I prayed to God and I went on the internet and Googled best prostate cancer surgeons in the world, and Dr. Samadi's name popped up. And from that point on, we've established a great working relationship. This is 3 years in the making. I want to thank my family, especially my wife, who supported me throughout this process, and the rest of my family. I want to thank the person who made this possible also, Mr. Anthony Clark, who kind of helped me out technically in getting this online. I want to thank one of my retired U.S. military friends who stood by my side and actually traveled with me to New York for the surgery. Mr. Richard Harris did, more than 20 years in the United States Air Force. I want to thank a sergeant major friend of mine who kind of also inspired me to get this done. His name is Sergeant Major Keith L. Craig, who wrote a book about leadership. And in his book, he says, if it's to be, it's up to me. So I put this out there for mainstream media years ago, and nobody it didn't take traction. So basically, I said, if it's going to get done, it's up to me. So here we are. So without further ado, Dr. Samadi, again, thank you for your time on this Saturday morning. Please leave remarks. I'll make this available after the interview process. So first and foremost, Dr. Samadi, what's prostate cancer? And then tell me some of the signs associated with it.
Well, Rudy, thank you very much for having me. And it's a pleasure to be with all of you. I know that not only you're a good person, but you're a man of faith. And I feel the emotions through this live stream. It means a lot to me. And absolutely what you said is true, that my relationship with the patients are very, very important to me. They're always in contact. And we have people like yourself, certainly from Florida. On Monday, we have people from Virginia. We have people from all over the world that depend on my skills and my commitment. And everyone knows that certainly with robotic surgery, this is something that has been very dear to me. This is my career, my profession. And for the last 20 years, all these cases have been handled personally with great outcome. And it's an honor to be with you. When we deal with prostate cancer, when people hear the word cancer, obviously there's a lot of panic and fear. Men, they don't get it because there are no symptoms. This is called a silent killer. 1 out of 6 men in America get prostate cancer, 230,000 men diagnosed with prostate cancer. And believe it or not, close to 30,000 men still die from this disease. And this can be prevented. So number one, screening is very vital. And I know because of the pandemic and because of Corona, a lot of people have not gotten their PSAs. They have not gotten their digital rectal exam. We can detect prostate cancer from rectal exam in about 10 to 15% of the time. You look for a nodule, you look for firmness, you look for something that could be pushing its way out of the prostate. And the rest of the time, we check this blood test called PSA, prostate specific antigen, which is not specific for prostate cancer, but if it's elevated, we can get an MRI and do a very targeted biopsy and find out what the cancer is. Not every prostate cancer is the same. Not every case should be handled the same way. every age and medical disease, and it's basically detective work. So um, we talk about something called Gleason score. Gleason score is the type of prostate cancer that people may have. So when they tell you that you have prostate cancer, find out what is your Gleason score. How many cores are positive? What's the percentage of each core that's positive? And always get a second opinion. And depending on what your Gleason score is, you may have a low risk prostate cancer or medium or high risk, and then we can adjust our treatment options based on that.
Now, for me, for example, my Gleason score was a 4+3. Now, if you can explain briefly, there's 4+3, and then there's 3+4. Can you briefly kind of explain that to the viewers?
So yeah, the Gleason score is a way pathologists classify the shape of these glands in the prostate glands, and the number goes from 2 to 10. It's the sum of two most common type of cancer that we see. The lowest number you're going to Gleason 2, highest is 10. Obviously, Gleason 8, 9, and 10 is high risk, very aggressive, need to be treated that way. Gleason 2 to 6 is considered low risk. And 7 is very interesting because it can come, as you mentioned, 3+4 or 4+3. The lower the number, the first number, better prognosis. So 3+4 has a much better prognosis than 4+3. Once you have a lot of 4 in your prostate, the behavior is very similar to high risk prostate cancer. And that's why when we have a young man like yourself, early stage prostate cancer, organ confined, meaning that the cancer is still confined to the prostate and still localized, then the cure rate is very high with great outcome, with continence, sexual function, undetectable PSA, which we will talk about, and all the options are ahead of us. And I'm glad that you went through this robotic prostatectomy 3 years ago. And we're very fortunate that 3 years later, your PSA is zero, you're enjoying quality of life, and you're here to talk about it.
Now, a lot of people have concerns about surgery versus chemotherapy. Now, I will be honest, I sought the kind of advice from 3 different urologists, but after my visits and its consultations with those particular urologists, again, I settled on yourself, and for obvious reasons, because again, I don't think every urologist is created equal, and so I have a comfort level with you and the way you explained it. And to be honest, your track record, your Samadi modified advanced robotic technique that we'll talk about. But for anybody considering prostate cancer treatment options, it was explained to me, and you can elaborate, that once you are diagnosed with prostate cancer, options are out there, from CyberKnife to the surgery to the chemo. What was explained to me was, if you have chemotherapy and it eradicates, pretty much your prostate uh, cancer to the extent where is no recurrence. But if there's any slight recurrence, your options are limited. However, if you were to have surgery, then if there's a reoccurrence, then you have more options out there. Can you kind of
Yeah, that's
elaborate
a
on that a little
great
bit?
point you're bringing up. And I think the word that you want to use instead of chemotherapy is radiation.
Radiation.
So
Okay.
let me explain to you. A lot of people hear all these ads about CyberKnife, and they think it's like a walk in the park. They go in for 5 days and they're cured. And I want to caution them that there are many differences between, first of all, CyberKnife, as they call it, robotic radiosurgery, has nothing to do with robotic surgery. This is a form of radiation, and it's very important, exactly what you said, is that when people get radiation first as a treatment, if their cancer recurs, surgery after radiation would be extremely challenging, if not impossible. So that's why a lot of younger guys in their 50s, 60s, even 70s, because now people go on to their 80s and 90s. So there was a time that we thought 67 is old, but today I consider them very young because they have many years ahead of them. So surgery is the first option. Why? You get the entire prostate, lymph nodes, and seminal vesicles out. They get a very accurate stage. I can tell them that, listen, the biopsy that you had beforehand is not as accurate. You had a lot more cancer, you had more advanced disease, and you have higher Gleason score than what we thought. So that's called a stage. Whereas radiation, that comes in many different forms, cyberknife, proton beam, other type of radiations, don't give you any kind of stage. What's interesting and important for a lot of people is they want to know if they're free of cancer or not. For you, you can get your PSA test and it shows undetectable, so you're cancer free, and that's very important. Whereas with radiation, you're going to have the fluctuations of PSA for 18 months. And in the future, since you keep that prostate inside when you get the radiation, more biopsies, and believe me, those biopsies are not fun. So nobody wants to go through those kind of things. But again, it comes to the point that if there's any recurrence after surgery or radiation, at least after surgery, we can give you a low dose radiation, whereas after radiation, would be very difficult to do surgery and you close many doors to yourself. And then other advantages, as you get older, you have to deal with enlarged prostate, urinary issues, where of course with surgery, that's going to be taken care of. Whereas with radiation, you will have a lot of problems.
Okay, I appreciate explanation of that. Now, again, what really was the how can I say, the home run for me is when I was trying to decide, what direction to go in. I was very uh, elated to know that there was a process or a technique that you had developed, and so your smart technique was one thing that really stood out for me. In addition to the more than 7,000 surgeries that you completed, so let the viewers know what exactly is your smart technique that you developed versus just the normal technique that most men will go through when they are opting for the surgery.
Well, thank you. So this smart technique that we talk about, Samadi modified advanced robotic technique, is very interesting because there are very few surgeons in the world who are oncologists. There are laparoscopic surgeons and as well as robotic surgeons. And because of that evolution of my career, I was able to really bring the best of the three worlds and combine it into that technique. Most surgeons, when they open up and do the robotic surgery, they open up the side of the prostate. They mobilize the nerves by doing the nerve sparing. So they basically move the nerves away from the prostate. They put sutures in the big dorsal vein complex. They put sutures in the bladder neck. And in that process, they can do a lot of damage to the nerves and the sphincter. And we don't want that to happen. So the my technique is basically, instead of like mobilizing the nerves and surrounding tissues away from the prostate, is by mobilizing the prostate away from the surrounding tissues. So I leave the nerves exactly where they are. I don't like to put sutures in dorsal vein. I don't put sutures in the bladder neck, and it's basically less invasive, leaving all the good things to the best of our capability where they are, and remove the prostate. And as a result, there has, in our hands, there was much more improvement in sexual function, in urinary control, leaving a long length of urethra, which led to a much better urinary control, which many is worried about. And now we see that a lot of people, even after a catheter is removed, they're able to have gain their urinary control, they gain their sexual function back. And that was a major improvement. And overall, we've done well over 8,000 of these surgeries here in New York, all over the world, and the result and the technique is superb, and it works really well.
So let me
These
add to that.
surgeries, these surgeries are about an hour and a half. I perform the entire surgery from beginning to the end. Of course, a lot of times when you are on top of your uh, practice, it's very important. There's a lot of patients who are younger. For example, I just saw a patient that is 52-year-old. Last week, I did surgery on 48-year-old. So a lot of people are coming in because of our expertise, and we're able to save their nerves, quality of life, as well as removal of the cancer, and it works really well.
So let me kind of add to what you just stated, sir. Dr. Samadi is spot on. That was one of the primary concerns, for a young person like myself. You know, two things that I think worry men is their finances and their sexual activity. And so, if you take one of the two, most men feel, less than a man. So, to be quite frank, I tell my wife, "You did more than your job. You did a great job." Because I have had little to no issues as far as erectile dysfunction. I know That's a big issue with men. Incontinence on my incontinence basically is how active I am on a non-active day, 100% incontinent. Uh, if I move around more, it's just like, and so there's nothing that bothers me. I think it's a joint relationship between the doctor and the patient. And anytime I've needed to reach out to you, that's one thing I want to express to the viewers, that that's what separates Dr. Samadi's smart technique, because there are many occasions that I've told my wife, say, Dr. Samadi, he outdid himself. And so when you opt for a doctor, uh, Dr. Samadi is in New York, and we'll discuss that at the end, how you can get a hold of him. Life is relationships and decisions. So my relationship with Dr. Samadi and the decision to choose him as my surgeon, I have not regretted it one moment. And so again, I just want to thank him again for at
Thank you
least
very much.
contacting me.
It means a lot. It means a lot, and I can tell you that this is one of the gratifying part of my career is taking people like yourself. I'm very fortunate that I call you guys my friends, family, all over the world. And if it wasn't because of generosity and kindness of our patients, who are truly like are part of my family, I don't think I would be able to do this kind of hard work day in and day out. So I really appreciate your kind words, and my message to a lot of people out there who are diagnosed with prostate cancer. If you call the office and they say, well, we don't accept Blue Cross Blue Shield, don't give up. Just tell them you want to talk to me, and we've been, I find a way to really take care of you. And I think your first treatment is the most important treatment, because fixing someone else's issue is extremely difficult and impossible. So we're here, and if anybody wants to get a second opinion through all these teleconference and new technologies that we have, we can reach out the entire world. So they can always call 212-365-5000. They can call 212-365-5000, or they can go to davidsamadi.com and they can send me directly an email or a message, and I get those messages and I'm happy to speak to them.
Okay, I got one question from a viewer, and the question is: at what age should men get screened for prostate cancer, and how often should we get screened? So let me caveat to that. We know that prostate cancer is more prevalent in the African American community and other communities of color. So I don't know if that's a two-part answer, but if you can kind of add some clarity to that. Again, what age should men get screened for prostate cancer, and how often should they get screened?
Well, that's a great question, and thank you for that question from your audience. So, number one, I like to get a baseline at the age of 40. I know a lot of guidelines talk about starting at the age of 50 or so, but I think that we are seeing so many young men in the early 40s with very aggressive prostate cancer that if we start later on, we're going to miss these people and they're going to have metastases. So I think getting a baseline PSA at the age of 40, especially if you are exactly what you said, from African American community, or you have family history of prostate cancer, your father, grandfather has prostate cancer, you would be at higher risk. And then what I would do is I would make an Excel sheet and make sure every time you get a PSA, minimum of once a year, put that on the graph, and let's see what the velocity and the speed of the rise of the PSA is going to be. So when you get to your 43, 44, you already have few numbers, and we can look at the speed of the rise. And that's very, very important.
Okay, thank you, Dr. Samadi. You briefly talked about it, and one of the questions before my final question is, how will the patient feel after surgery? Now, for me, before you answer that, I'll just say this. My process was, after the surgery, I stayed in Lenox Hill Hospital for, I think, 3 days. You just soreness, obvious soreness, but I know after the surgery, the requirement is to walk up and down, in my case, the hospital floor to alleviate blood clots. Kind of explain what that process is after the surgery. Why is that so important?
So number one, we're no longer at Lenox Hill. I became director of St. Francis, director of men's health at St. Francis Hospital, one of the best hospitals in New York. It's a 5-star CMS rating, and it's in Long Island. No residents, no fellows, as I always have performed these robotic surgeries from beginning to the end. myself will continue to do the same with very high volume. And I think people will really enjoy this hospital. St. Francis Hospital is a big healthcare Catholic system in Long Island. And of course, our main center is in Manhattan. The recovery after prostate surgery, robotic prostate surgery, is fairly easy compared to what we used to do in open surgery. And I think today, nobody in the right mind would go for open surgery anymore because there's no reason in our hands, having all the technology, the visualizations, to really like cut people open, to have all this pain and suffering and transfusion, etc., that we used to do in open surgery. So the blood loss with robotic surgery is minimum, pain is minimum. We want the patients to get out of bed within 24 hours, walk around, making sure that there's no blood clots in their legs. Catheter will stay for about a week or so. And some people have the fear of this catheter, but I can tell you that it's placed in when you're in sleep. You feel like you have to urinate, but it's easy to manage, and when it comes out, it's not that painful. So overall, I think it's pain is under control, recovery is fast. They can get back to work earlier, and we've come a long way in this field. So I certainly encourage people to look into robotic prostate surgery, and this is one of the highest volume center in the world, and we can save their lives and their quality of life.
Let me add to that also. Again, when I decided to fly to New York, your office worked in collaboration with the Hope Lodge, through the American Cancer Society. Is your office still involved
Yes,
with coordinating?
yes, of course we have a. It's very important because we get patients from all over the world, all over the country. So when it comes to the concierge part of that, getting you the hotel, place to stay, what to do, I'm very fortunate that we have one of the best staff in the world, and they can more than happy like to help you. And I think it's the easy part. Yes, we still collaborate with them. We give them donations to help the patients with prostate cancer.
Outstanding, Dr. Samadi. What I want to kind of get into is when you are taking patients, what's one of your overall goals in terms of it? Again, you got before the surgery, after surgery, but one of the things again that it separates you from most healthcare professionals, urologists, is your just personality to want to and keep your patients involved. And we've talked about, you have the patient, and then you also have the spouse. And so my spouse, my wife Kimberly, came to my surgery, and just kind of briefly discuss how that is a component of your practice as well.
Well, that's a great point you're bringing up, and I think that I think the medical community is fairly exhausted. I think the doctors have been working extremely hard on overdrive. They are spending a lot of their time on paperwork, insurance issues, etc. And they just see the prostate cancer, and they don't spend a lot of time seeing that there's a person behind this prostate cancer. There's family that is being affected by this. So I like the art of medicine, besides like the technical component and developing all these robotic surgery and the technology. I like spending time with my patients. They know who I am. I enjoy it. It's a personal relationship, and I think it's you get to know them, you care for them, you give it 200% of what you have, and it really goes very far. And they remember. I mean, I see patients now. They send me letters, or they still come 15 years, 20 years later. Doc, I miss you. I love you. I just want you to know my PSA is zero. We pray for you all the time, and we see you on Newsmax when I was on Fox News, etc. So it's a small world, and I think we're here not only as a healer, as a doctor, for a short period of time, and what you do for people, it will come back to you a million times more. And I have seen it in my career, and that's the way I treat my patients. They're not just a bunch of numbers. They're not just another cancer. Our we've touched many hearts, I see the children, I see the wives, I see the families, and to me, that's really important, and that's the way I think that's a key to our success. And the patients also see it. So, if you're diagnosed with prostate cancer, my message is, um, don't think about the insurance first. Let's talk. Let me solve the problem for you. We can always find a way to like take care of you. And I think that experience matters. Um, it's important who is behind these. There are centers that they run 3 rooms, 5 rooms, 4 rooms, and the doctor is there only for 15, 20 minutes. Whereas at St. Francis, you get the entire samadhi from beginning to the end. All of these robotic surgeries that I've done in the last 20 years, I've always been there 200%, took care of the patients from beginning to the end because their quality of life is very, very important to me. And I think it's been a great ride and it's been a successful ride. And I'm very grateful to have patients, friends like yourself, who are cancer free and really enjoying life.
Well, again, Dr. Samadi, I count it a blessing. I often say, what God has for you is for you, and what God has for me is for me. And things just don't happen through coincidence because we were put in touch with each other. And good Lord, know I needed somebody of your expertise, your personality, your faith, and honestly, your caring attitude. So I just want to say thank you. And just let my viewers know, coming from Florida, from humble beginnings, that's one of the things that kind of was on my heart. And people all the time ask me, why did you fly all the way to New York? Well, if you haven't learned why fly to New York the last 25 minutes, I don't know what else to tell you because Dr. Samadi has demonstrated through his efforts on behalf of his patients in cancer awareness and treatment that he firmly is behind 100% of what he does. And so you're hearing from me, just a normal guy, 23 years in the Army, 9 years teaching school, Winter Haven High School, Army Junior ROTC. I've come across quite a few men, and I never miss a moment to articulate first and foremost to men and family members who are female. Hey, if you got an uncle, dad, you need to get that prostate checked. And if you are unsure, please reach out to me. But more importantly, the relationship I've established with Dr. Samadi, he's made himself accessible, approachable, and available. And on this Saturday, I realized that a lot of people have things going on the golf course. That's why I'm going to make this available for weeks and months to come. And so I was just ended by telling you, Dr. Samadi, again, thanks. It's not just you, your staff, your family. I'm always in constant prayer for you and your practice. I look forward to seeing you next month when I fly to New York. I've had my COVID vaccination shot, Johnson & Johnson version. And so are there any parting words of advice or wisdom that you want to impart to our viewing audience? Again, they're going to be have an opportunity to view this after the live session, but I definitely want to give you the floor to add any parting comments again.
Well, I want to thank you, obviously, for doing this. We love you, Rudy. All of my patients, I'll continue to fight for every life. Every life matters. We love you. And I appreciate the kind words. I know that you're, like I said, man of faith, and your prayers means a lot to me. Understand that prostate cancer doesn't have to be a killer. We can save your life. I know you're worried about surgery, radiation, chemo, but we don't want you to get to radiation. We don't want you to get to chemotherapy. When this bird is contained in the cage, when the cancer is contained in the prostate, your cancer cure rate is so high. Your survival 10 years is extremely high. And thank God we have the technology, we have the technique, we have the vision. Images are precise, and everything is all there in the operating room, minute by minute, millimeter by millimeter, looking at the nerves, looking at the cancer, and try to save your life. So we are here. We can save your life. Getting a second opinion is always important. This can be changing your whole life. So don't be afraid to get a second opinion. And again, I thank you for doing this, and hopefully we can save some lives through this. Anybody with prostate cancer, they can go to davidsamadi.com or roboticoncology.com and send me a message directly, or call the office 212-365-5000. Very easy to remember, Rudy. It's the number of days in a year. That's how we work. 365. 212-365-5000.
Well, sir, again, I want to thank you for taking your time on this Saturday morning.
My pleasure.
The bell you just heard is that tells me my time is up. Only again, I just want to say thanks to you and the viewing audience. When I was in Afghanistan, I didn't invent this motto, but this motto stayed with me, and that's one team, one fight, and one family. And I think that really epitomizes your practice. We're one team in one fight, and we're all one big
I
happy
like
family.
that. I like
And
that.
so,
One team, one fight, one family. I like that. I like that
hey,
very much, Rudy.
you can have it for free.
But that's true. But that's the way I've always like one team, one fight, one family. I got it. That's great.
So,
God bless you. Thank you for doing this, and we look forward to like many great moments and many more zero PSAs, my friend.
all right. Again, you enjoy the rest of your day, and
Be well.
God willing, I will see you next month. God bless you, and again,
God
thanks
bless
again
you
for your
too.
time.
Thank
Yes,
you, and
sir.
God bless this country. Take care, my
Hey,
friend.
yes, sir.
Bye-bye.
Bye-bye. All right, folks. Before I end my this process, I just want to say again, thank you for the viewing audience. I realize that it's a Saturday morning, but also keep in mind that Dr. Samadi did this at his own free time. No money was paid for this. I did this out of my relationship with him. He's been wanting to do this for the last couple of years. Again, I tried to reach out to media organizations to try to get this, but at the end of the day, it didn't happen. Thanks to a good friend of mine that I've known for a few years, Sergeant Major retired, U.S. Army Sergeant Major retired, that is, Keith L. Craig, who wrote a book on leadership. And in that, he coined his motto, if it's to be, it's up to me. So honestly, this call came into fruition because, if it was going to happen, I had to realize it was to be. It had to be up to me. And so that's what this is all about. I'm just a regular guy trying to use my God-given talents and abilities to get the word out about prostate cancer. So again, thank you for taking your time out. Those of you who did listen to the interview with Dr. Samadi. Thank you again, and enjoy the rest of your day.